Okay, good old echinacea. We do think the form matters. So, lipophilic extractions, there's a great review that looks at the 30 intervention trials for echinacea as prevention for upper respiratory. And the lipophilic extraction is the one that is more superior to any other extraction method. And the most prominent impact for echinacea is prevention of upper respiratory tract infections. So, we don't really see, you may find the occasional paper that's captured a small reduction in duration of symptoms with echinacea, but the vast majority of data is that it's prevention. Okay. And the pooled data is pretty strong. Like it's reducing the frequency of upper respiratory tract infections by like 30%. It's decreasing the use of antibiotics because when we look at antibiotic stewardship, one of the challenges we have is when people get sick, they often want a prescription for antibiotics. The structure of the healthcare system where they really don't want to see people back. They often are leaving with an antibiotic prescription, even if they have a self-limiting viral illness. So echinacea actually makes a measurable change in the number of antibiotic prescriptions, especially for children, which from an antibiotic stewardship perspective is very positive. Every time we can decrease unnecessary antibiotics, we're doing good by the entire healthcare system and all people. Um, and so we definitely want people to reduce that as much as possible. The side effects are really low, right? We generally sometimes we'll even see more like side effects or problems in placebo groups because echinacea is either being compared to vitamin C, where there's more side effects from vitamin C than echinacea, or it's being compared to nothing, and those people are sicker when they do get sick. And so that's like one thing that echinacea like has such a high safety profile. But that's really where it lives, right? There's some great pediatric data decreasing cold and flu. When patients take it before they get a cold, they actually are decreasing their risk of a second or like, the unresolved first, and then they get a second infection or a second infection by about 30%. It's increasing the window between pediatric infections. And so for kids that are getting recurrent upper respiratory tract infections during the winter, it's going to delay the time to the second infection. So we see like over and over that we have pretty strong prevention data. And the vast majority of this is pre-2020. So the COVID data is not as good. They have tried to like pull out COVID like data from other data that we have from the past or using it as like a secondary outcome from other studies that are looking at echinacea. But the COVID data is not as strong. So usually it means we're talking about things like influenza and we're talking about things like RSV. Um, we don't have any COVID specific studies that are looking at echinacea as of right now. But there's great data that it prevents that upper respiratory infection, less, symptom days, less episodes, and in the best sort of pediatric paper, the number needed to treat was also quite low. So 4 kids needed to be treated in order to prevent one upper respiratory tract infection. Like if you ever look at number needed to treat, sometimes people are shocked at how many people we need to treat with medications to prevent one outcome. It's usually high. But this is actually really low. And again, the pediatric data also is like really strong that it's reducing the risk of needing antibiotics, which again, the stewardship is super important.